Welcome back. For many voters, women's health care was top of mind. Now with a new administration headed to the White House, what changes could be ahead? Our medical team is here to talk about that and much more. Dr. Ngozi Ezike, President and CEO of Sinai Chicago, joins us along with Dr. Jeffrey Sterling, author, President, and CEO of Simcoe. Good morning.
Good morning.
Thanks for joining us. Great to be with you guys again. It's a big week. Big week. The next president and Congress and the Senate too, obviously, already all elected there, will have the power to put their mark on major healthcare programs, and we're just going to see a lot of changes possibly moving forward. Kind of tell me what are the things that you guys are anticipating or just getting ready for should the new administration make any changes?
Oh my God, there's a lot.
There's a lot.
There's a lot. I mean, I can roll off 5 things off the top of my head. There's changes to the regulatory agencies like the CDC, the FDA in terms of how drugs will be approved and accessible to the public. There's Medicaid expansion that literally could be going away, given how it's not frequently used in some of the states that supported the currently elected president. The Affordable Care Act, it's been said that that's going to be repealed and replaced potentially. The women's health issue, of course, is a huge deal again. So there's just a lot. And I said 5, drugs. The drug pricing scheme that was just revised to where insulin can be priced at $35 per dose. That all may be on the table, and that's not a political consideration. There are actually reasons for those policy decisions to be made, so there's a lot to keep track of.
Yeah, definitely. I mean, remembering that Medicare and Medicaid, there are 150 million people that get their insurance and get their health care through that. That's almost half of the country. And so, you know, I think of that a lot in terms of the safety net health systems. When we think about health equity, 90% of our patients are Medicare and Medicaid beneficiaries. So being able to ensure that they will have that access to care, that there will be supports for the quality of care for these individuals is super important.
And as far as, you know, we talk about bringing down the prices of prescription drugs, and of course being able to, you know, we mentioned the Affordable Care Act there, as well as, you know, a lot of Americans are saying, at least a recent survey finding 2/3 of Americans say that healthcare should be receiving a little bit more attention. Moving forward, the uncertainty or the certainties of what could be coming, what would you all as healthcare providers like to see moving forward that could make things better for everybody?
I think it's critical that we understand the importance of having people with access to care, and that's what insurance provides, that's what the ACA provides. 23 million people covered under the ACA. If there's a significant shift in terms of the government coverage of the monthly premiums, that will mean that people have to pay out of pocket more, and if they can't, they just won't get it. And when you don't have access to care, that starts a whole cascade of additional events that usually results in much worse health outcomes.
Let's transition to this month is November, American Diabetes Month. And some of it might be, a lot of people might be familiar with this, whether they deal with that or they have a family member dealing with that. But what are some of the things that people should know to bring awareness to what this month is about?
Yeah.
Well, I mean, this gets back to the fundamentals. You know, one of the things that we talk about a lot is blood is life, and things that affect blood flow diminish the quality of your life, and diabetes is one of those diseases. Whether you're talking about the prior conversation or this conversation, we need to, as a nation of individuals that embrace freedom, we need to be better stewards of our own health care. We say that again and again and again. So diabetes awareness doesn't begin with diabetes treatment. It really should begin with how to avoid the disease. And I think that's, in the current climate and the upcoming climate, it's just going to be so much more important than ever before to realize that you have to do the things to stay healthy so that you don't have to worry about getting well. And when it does come time to get treated, to get diagnosed, try to do so expeditiously. Take-home message for everybody is really just be aware of your own health and look for signs and symptoms that tell you that this may be occurring, and try to get that care as quickly as you can.
I think it's important to highlight how prevalent it is. You know, we have a lot of people with diabetes. 20% of people who have diabetes don't even know it. It's the 8th leading cause of death in the United States. And so, again, access to care, access, you know, having insurance so that you get checkups regularly, because a lot of people, 1 out of 10 people have either diabetes or pre-diabetes. And so if we could identify, you know, with simple blood tests that, oh, you're pre-diabetic, you can reverse the trend from pre-diabetes to diabetes, and that's what we want. We don't want to be dealing with the after effects of diabetes and kidney disease and heart disease and strokes. We want to be able to encourage healthy activity, make sure people have access to healthy food, and do the things that can prevent them from getting diabetes or progressing from pre-diabetes.
And is that a matter of, are there certain symptoms to look out for that you present to your doctor and say, hey, like, your doctor would probably be smart enough to say, let me test you for this, but what kind of symptoms that should people look out for within themselves to say, hey, I should probably talk to my doctor about this to get those blood tests?
Yeah, once you get to those symptoms, it's a little bit late.
Okay.
Yeah. So I mean, I'm happy to answer the question. I mean, you get weight loss, you get increased thirst and increased drinking. Those are the types of, I just have to continue to emphasize, you don't want to get to that point. People always talk about diabetes runs in families, but what actually is happening is that bad, with all due respect, nutritional habits run in families. The same cook promotes those habits that lead to diabetes. The conversation really, from my vantage point as a preventive health person, is to really direct people toward trying to stop that at the pass. But of course, if it gets to the point to where you're symptomatic, you have to be reevaluated. But given everything happening, you're going to keep trying to drive that point home. You don't want to go there because the options might not be the same.
We have to lift up physical activity. We know that lots of activity, especially if you have a desk job that keeps you in a chair for 8 hours a day, we have to make sure that those other times that you take breaks and you get walks, like physical activity is an important tool that can help stave off diabetes and just give you better health in general.
Yeah.
Can we say that for the people in the cheap seats? Activity is not the same as exercise. People who have the longest
just do something. Get up.
People who have the longest lifespans on earth don't live next door to a 24-hour fitness. You can get up and be active and improve your health. Every level of activity strengthens your heart. Absolutely.
Well, you mentioned good nutritional habits, but we are entering a season where we're going to eat a lot and probably drink a lot, all in good fun and celebration of the holidays. But besides doing that in moderation, go for a walk after Thanksgiving dinner, but also the mental health of people. It can be a really happy time for some people, and it can be a hard time for some people. Kind of talk about the importance of still checking up on everybody and making sure there's not a mask of, oh yeah, I'm so happy it's Christmas or Thanksgiving, but there could be some hardship there that could be worth a check-in with some people you love.
Yeah, definitely. I think the holidays, like you said, are a really mixed bag. Some people, it's all joyous, but it's stressful. You've got family coming in, that could be good or bad.
Yep.
You have all this cooking and present wrapping and, the finances of trying to fulfill what is on people's wish list.
Right.
And all of that. So it can be stressful. It's important to always be checking in on our neighbors, on our community members, and just looking out for each other. And then, just when you feel yourself having, anxiety or any of the stress, like knowing that there are opportunities, whether it's through your work or through your religious institution, like looking for someone to talk to and share some of the concerns so we can kind of tamp down on some of the stresses.
Yeah, and it can affect children too a little bit.
It affects everyone. Stress, it's kind of important for people to understand. Stress is the difference between expectations and your reality. You talk about this as the season where people are going to be eating. How about this be the season where people embrace the joy in their life and people can, within their own communities and their villages, support each other and uplift each other and try to emphasize and accentuate the positive.
Yeah.
That can do very well in terms of lowering the stress, because stress is a part of life and it's going to happen to some extent. So if you can't avoid it, you better try to be oblivious to it and then try to deal with it if you can't do anything other.
Right. Embrace the joy of the season. No pressure on yourself, right? Thank you so much. You can find details on the services and programs offered through Sinai Chicago at sinaichicago.org. And Dr. Sterling's 8th book, look at you, 8th book, is available now. It's called The Prevention Imperative, so check that out. And when we return, it's film festival season in Chicago. We have a preview of what audiences can expect at Black Harvest this year.